Don't miss that!
Welcome back to Don't Miss That Radiology. Today we're covering one of the most important decisions you'll make during residency application season: how to use your ERAS signals. A few clicks in ERAS can dramatically change your chances of getting interviews. And today I'll explain the data, common mistakes, and exactly how I think medical students should approach signaling for diagnostic radiology. I am the pathway director at a East Coast medical school. You could probably look it up, figure out where I am, but I get actually med students from all over who come to take rotations with us. So I have a lot of experience with mentoring, advising med students. And the great thing about advice is you can take it or leave it. I think most of the students find my advice helpful, and I've had a lot of success with my students over the years. And I think it's a lot of fun. This is a stressful, at least for me, for the students, it can be a stressful time, but helping to guide them through that. I had some great mentors, so I try to play it back, play it forward, and give them equally good advice. So let's dive right into it. So signaling, they've been around since 2023, and it has really decreased the amount of congestion with applications. For radiology, you get 6 gold signals and 9 silver signals. When I was an applicant more than 20 years ago, no signals. It was sort of like the Wild West. You apply everywhere. You actually had to interview in person. So that was expensive. So that was sort of the rate limiting step. People wouldn't apply all over. You'd sort of know that, hey, it's going to get expensive. So you'd be a lot more strategic in your interviews. But with COVID, virtual interviews, people started applying a lot more, and it sort of got crazy. So I think that was the impetus for signals. And we've been trying it out for the past 3 or 4 years, and this is a great article from JACR about the initial success, results, consequences of having this signaling process. And I have a couple of screenshots from here, which I will share. And so remember, for radiology, we get 6 gold, 9 silver. So as pathway director, this time of year that I am talking about signaling with my advisees. We had a dean's meeting, and the deans just re-emphasized the importance of using the signal strategically. So with 15 signals, the chances of you're matching at one of those 15 is extremely, extremely high, and likewise your chances of getting interviews and matching at one of those non-signal places is much, much lower. So use those signals strategically. So I like this. Signaling was introduced to answer one question. If you could only tell a handful of programs you're truly interested, who would they be? So I think that should be your motivation, sort of go through your thought process for where these 15 are going to be. And we can talk about the importance of gold versus silver. There's definitely some statistical difference. I always say keep it simple, rank them as you see it. I think the fact that you're signaling it is extremely, extremely important. That's the most important thing. When I applied for residencies, I only applied to 10 places. I was limited by my wife. I knew I had to either be in Pittsburgh, Cleveland, or Atlanta. She was a postdoc finishing up. Those were the 3 places that she wanted to move. That made it easy for me. I interviewed at those programs and wasn't applying all over. So those were my signals, and the places knew that I was serious about going there. So now with the modern age, with the ERAS signaling, we only get 15. So let's use it strategically and ask ourselves, does it actually work? Well, the data is extremely, extremely solid for the importance of signaling. For places where applicants give a gold signal, it's been estimated that 68% interview rate. For silver, 52% interview rate, and no signal, 1 to 8%. So again, the importance of using your signals appropriately. So let's talk about some common mistakes. The first one is using all your gold signals and silver signals for that matter to dream programs. Um, Realize a lot of you are getting your step 2 scores, and that is extremely important for determining how competitive you're going to be at these different programs. And when we say dream program versus a realistic program versus safety program, realize I put these in quotation marks. There's no such thing as a safety program in radiology anymore. Radiology, I don't have to tell you, is extremely competitive. Um, there are safer programs, and we can look at data on Residency Explorer to see where we fit in terms of the 25th to 75th percentile, the mean, the median. That is very helpful information, I think, just to figure out how competitive we're going to be. And especially, I think, if we're on the lower side, we have to, the mean for radiology on STEP. If we're significant, if we're standard D below that, we have to be extremely, extremely strategic about where we are applying and applying to a lot of those safer schools. But realize a lot of these safer schools with lower STEP scores might be community programs that are only taking 3 to 4 people each year. So then it becomes like a numbers game. So we got to keep that in the back of our mind. We might be the best applicant, but we're number 5 on the list, and there's 4 other people in front of us who matched, and we might be number 5, number 6 on a bunch of these smaller programs, and we end up not matching. So need to keep that in mind also. And then in these cases, I will have a tough discussion with the students, hey, that we need to have a backup plan. And this is where you talk about dual applying, or you think about worst case scenario. If I don't match, what would I do? I always like to think about worst case scenario, and then if it doesn't happen, that's good. We matched into radiology, but I think the worst thing you can be is unprepared or blindsided by this whole process. And that's why it starts here with the signaling and using those appropriately. So other great resources to figure out where to go or how competitive you're going to be are Doximity and then Residency Advisor. I had a recent student who really liked Residency Advisor because it told him how many hospitals he would be rotating at from that program. That was a very important criteria for him. He didn't want to be going all over the city. He just wanted to be at one main hub. So that was very helpful for him for his signaling and decision-making process. So I thought that was pretty cool. Okay, let's talk about mistake number 2, ignoring program fit. So programs don't just want smart applicants. They want applicants who want to train there. So this comes into topics like geography, academic versus community, fellowship goals, research, family, culture, and then also I'd put how many hospitals are you rotating at? So the student I was just talking about only wanted to be at a hospital where he would be at that main hub. Now I'll just put a caveat on there. Sometimes you have to rotate another hospital. A lot of times you have to rotate another hospital for pediatrics, and especially at small community programs, that might be at a larger pediatric hospital that might not be in the city where you're training. So that is a great question to be looking into now, a great question to be asking about with interviews. Geographic preference, that's something I was talking about with a lot of my pathway advisees. I think that's extremely important, but I would say not as important as the signaling. Mistake number 3, thinking that signals guarantee interviews. They don't. They simply increase the odds. So that's why we need to check our STEP scores, be cognizant of our clerkship grades, how strong our letters are going to be, research, especially if we are applying for a academic high research institution, our personal statement, and that overall fit. So my advice, when I advise my students, I tell them, is this a place you're going to be excited about to train for 4 years? If yes, it's probably worth a signal. Don't game the system. Use them honestly. Now, in terms of the numbers, I found this extremely, extremely helpful. The advice, basically the general consensus from the authors with our 15 signals. use 2 of our golds for aspirational. So these might be programs that might be like over the 75th, percentile of our step score, or maybe you're coming from not a very good medical school, but you're applying for one of the ivory tower programs for residency. No more than 2 for that. For our likely to match, again, our first criteria is going to be the step scores. We want to be about at the mean for that with our step scores, plus or minus a little bit, but using 3 gold, 3 silvers for that. And then we're not calling them safety, we're calling them safer programs where our step score is higher than the mean there. 1 gold, 3 silver. I think that's pretty balanced. Again, there's going to be some exceptions with geography, personal circumstances, but I think this is a good template to start with. So, my take-home points. Use every signal. Use it smart. Be strategic, not emotional. And remember, a signal gets your application looked at. Your application earns the interview. And we'll have more podcasts, so hopefully you're liking this one. We'll talk about interview strategy as that comes up in October. But I'm hoping that this podcast about signaling makes this process a little less stressful. If you found this episode helpful, please subscribe, leave a review, and share it with another medical student applying this year. I'm Dr. Matthew Hartman, and until next time, don't miss that. Thanks for listening to the Don't Miss That Radiology podcast. I'm Dr. Matthew Hartman. Remember, you only see what you know. Keep learning, and don't miss that.